Hello, thank you for joining us today. My name is Leah Hailu, and I'm an intern with the Equity, Inclusion, and Diversity Committee here at Mayo Clinic's Department of Laboratory Medicine and Pathology. For today's video, I'm here with Mariah, and she will be answering a few questions about her role and her experience at Mayo. So Mariah, if you'd like to introduce yourself a bit.
Okay, hi everyone. My name is Mariah Ross. I currently am a clinical lab technician in the antibody immunology laboratory located on Superior Drive Support Center. And I've been in this role for a little over 2 years. I moved here from New Jersey right after college, and the rest has been history.
Yeah, thank you. So can you tell me a bit about some of your favorite things in your role?
Yeah, well, for starters, um, as a clinical technologist, a clinical laboratory technologist, each role looks different no matter, depending on what lab that you're working in. My lab is a mix of manual work as well as automated. Sorry, I cannot find the right word. So I think my favorite thing to do, because we get the diversity of the type of testing that we do, I love to do the manual works, and that's like my favorite thing to do. And because with that, like, you have to stay organized, and organization is like my thing. So it is my favorite thing to do altogether. Anything that has to do with organization, the manual side, that's me.
Thank you. And can you mention a couple of qualification or skills that you think are really important in this role?
Yeah, I think with anything that has to do with working in a clinical laboratory setting, I think being detail oriented to whatever degree is super important, because we want to make sure we're getting the quality results out to our patients. We want to make sure that we are staying up to date with the qualifications for the CAP standards, as well as all of the, higher up kind of standards and good practices. I think another thing that's super important, I know for my lab, for a lot of labs, I think just being open to working on a team, because most of the time when you're on benches, there are some benches that you're able to work by yourself, but most of the time, whether you're by yourself or with a partner for the day, like, you still need like that team aspect, or being able to ask people for help or offer help, or being able to work with somebody. So yeah, that's a huge qualification. And I think just having somewhat of some type of interest in doing what you do, because most of the time we're on our feet all the time, working blood, sweat, and tears. So you gotta like what you do. Just just a little bit,
Of course, of course. So can you tell me a bit about why you chose Mayo Clinic?
Oh, that's a good question. Oh, why did I choose Mayo Clinic? um, when I first heard of Mayo Clinic, because I'm from the East Coast, so I mean, when you hear Mayo Clinic, I was thinking like top of the top, like Grey's Anatomy type thing, but I always knew it as this, like, the best of the best when it comes to hospitals and care and all of that. So when the opportunity arose for me to come and work at Mayo Clinic, coming from a little girl from the East Coast, like, that's a big opportunity. And I felt like whether, it's for resume or whether it's for the experience, I just think just like being here, I knew that right out of college, I was going to get like the best experience from working at a amazing institution such as Mayo Clinic. So without a doubt, hands down, in October, before I graduated college, you couldn't tell me nothing, because I'm working at Mayo Clinic.
Oh my gosh, I love that energy. I love that.
Yes.
So can you also tell me a little bit about how working at Mayo compares to other positions that you've had?
Yeah. Um, prior to working at Mayo, I was a college student, so I worked at a grocery store.
Mhm.
And a lot of the times, like the motto that the grocery store always had was like, our, what did they say? Oh, our employees are our assets. And they would, make sure that the employees were taken care of, which is good, which is really good for a company such as a grocery store. So coming to Mayo Clinic and I guess the model has changed where it's the patients come first. So a lot of it, like, I had to learn that, like, no, it's not about me as an employee. It's about like the patients all together and, what they need and all that. So I think that's how it compares, like, because then they get a better experience. And then this is why you get like, how it's so popular and so world renowned is because like they take care of the people that come here, which sets it apart from anything else that you'll ever experience.
Yeah. And that segues well to my next question, actually.
Oh,
So I was
okay.
gonna ask, how does the work that you do make a difference for Mayo patients?
Well, great question. The work that I do. I think altogether, like, again, I had to just go back to talking about me being in the East Coast. That's where I'm from. I remember, going to the doctor's office and getting blood work done and getting labs drawn or whatever. And it would take weeks for me to get results. And I never knew that there was a, possibility it could ever come out sooner. Because it goes to the lab and it takes weeks for it to come back, whatever. But I think, at a place as such as Mayo Clinic, where, because we care about our patients so much and we want those results, that turnaround time to be, so short, I think it makes a difference to our patients because they're not waiting weeks, they're not waiting days to get, their results. You can get a COVID test and have, they'll tell you that you'll get your result in 24 to 40 hours, but you get it in 4 hours. And like, I think that's what shows that like the people here work hard so that the patients can get what they deserve. So even when I had experience down in the COVID lab, man, we were pumping those samples through because, as Mayo Clinic always stays, like, we want our patients, number one, to have trust in us and, come back. And I think having those quick turnaround times for those COVID results or any result, it just is helpful to them in getting the diagnosis that they need and so forth. So yeah.
Yeah, thank you. So now, can you tell me a story or an experience that you've had at Mayo Clinic that provided you a sense of belonging?
Just to note, as a minority, as someone who lives in suburban East Coast, coming here was hard. Number one, it's hard to find people that look like you in the role that you have. It's also a culture difference because a lot of people here are used to farmland and ruralness and all that. And, it was a huge shock to me. And then coming here, like, it's hard to find your crowd and where you fit in. Coming here, I did, make a few acquaintances and hang out, but it never was like, I don't know, it never felt like, I belonged. And I think that wasn't until, I think around the time that George Floyd had passed away, and he was, I'll say, assassinated. And I had I was working in the COVID lab at the time, and I had coworkers come to me and just say, hey, I know what you're going through. I'm here if you want to talk. Like, it was messed up what they did. Being a part of, like, and hearing that, and being a part of different, like, groups of people in that lab and in that work area, saying that kind of made me feel like, okay, people actually do care about me and how I feel when I come to work. Even like, the doctor who's over our lab sending out emails and, to speak to other people in our labs about what's going on. I think that kind of like opened my eyes, like, okay, maybe you're not the only one that feels how you feel in your area. So I think, yeah, that's where I feel like I belong, because then there are people who do sympathize with the fact that like I'm far away from home, or I identify as a Black woman who is going through, the trauma of seeing a man killed and dealing with being here and not having family. I think so, because I had those coworkers approach me and talk to me, like it has sparked lifelong friendships that I will ever be indebted to Mayo Clinic for providing me with. So
Yeah. Thank you for sharing that. I
yeah,
appreciate it.
yeah.
And for my next question, I was wondering, where do you see yourself and your future at Mayo Clinic?
Yeah. I think the beauty about Mayo Clinic is that it has a lot of different kinds of roles. So, per se, like being a clinical lab technician, for me personally, it doesn't seem like it's something that I want to stay at, because I feel like I want to do more. I want to do more to help the patients. I want to do more to, get people on tasks, or organized, or, just use my skills like the best of the ability. And
Mhm.
I am, needless that I am enjoying where I am now. I really do. But, in the future, like, I don't know where it may take me, maybe like to be a supervisor, where I don't know, but because like it's such a huge world out there with, in Mayo world, who knows where I'll be next.
Mhm. Yeah, no, that's okay. Sometimes you just gotta trust in the universe and just see where
Yeah,
it
I just, yeah, I just wait on God to tell me where to go next, and that's where I'm going, or the right opportunity to drop into my lab. So,
goes. Mhm.
yeah. Uh, yeah.
So I'm at my last question, and
Okay.
I just want to know, is there anything else you would like to tell our audience about Mayo Clinic or share about your experience?
Um, anything I would tell our audience about Mayo Clinic? Um, this is a great place to work. Be transparent here, just like any company, especially one as large as Mayo Clinic, there are bumps. Like, and not everyone's going to agree with certain things. Not everyone's going to like different things.
Mhm.
But it's all about like how much you're willing, on for it. And you really have to be willing.
Like, you have to be willing to take chances.
Yeah,
And
take a chance. Just take a chance.
so thank you, Mariah, for speaking with me today and speaking to our audience about your experience.
Thank you so much, Leah, for having me.